Are you curious about designing a modern world for dementia? Welcome to What's Next Canada, Canada's premier aging and brain health conference, repurposed for you in a special podcast series. Listen in with our host Mel Barsky as he introduces the Innovation Panel. The moderator is Bianca Stern, Executive Director, Health Innovation at CABI. The guests are Simon Cheeseman, Director for Baycrest at Home, Phil Goodfellow, Partner at G Architects, and Jane Barrett, Secretary General at the International Federation on Aging. Here we go. Now streaming, listen in to this innovation panel about designing for dementia.
We're going to move right into our next session, which is an innovation panel called Designing for Dementia. Dementia-friendly communities play an important role in enabling aging in the setting of one's choice. Real estate developers, healthcare providers, and manufactured housing companies are working with innovators to bring services and supports into the community. We're going to learn more today about the opportunities for purpose-built and adapting existing housing stock and infrastructure. The panel is going to be led today by Bianca Stern. Bianca is the Executive Director of Health Innovation here at CABI. Bianca's career spans over 35 years, maybe 10 years, in healthcare within private and public sectors, including community, post-acute, and long-term care. She has also been involved at university and college levels in curriculum design, research, teaching, and student mentorship. Bianca has built on her bachelor's degree in occupational therapy and master's degree in rehabilitation science, creatively intersecting the art and science of healthcare and innovation, technology, and industry. Bianca is a thought leader in the area of innovation, blending design, thinking, and arts-based tools with an inclusive, participatory user focus, capitalizing on emerging technologies and theoretical knowledge to stimulate innovative solutions for the journey of aging. Bianca currently oversees the innovation team at CABI, including the Design Lab, the Seniors Advisory Panel, the Innovation Office, and Project Pipeline. Bianca is also actively involved in helping to foster a culture of innovation and knowledge mobilization here at Baycrest Health Sciences and across the CABI network of partner sites. I'm going to turn it over to you, Bianca.
Thank you, Mel. This has really been a very interesting day, and I know I speak not only for myself to say that I'm learning so much in each one of these sessions, not least our session today now on designing for dementia, a topic that's close to my heart and to the heart of all the panelists that I have here today, and really pleased to be introducing to you. The gentleman on my left is Simon Cheeseman, and I'm going to tell you a little bit about Simon's role here. And our two other panelists will be joining us virtually. So this topic, designing for dementia. Throughout our lives, we live in spaces that we create with others. More than mere spaces, we actually intentionally make them special places, places of attachment and identity where we belong, we find meaning for ourselves and with others. We bring our places to life with objects that we collect and treasure, activities and rituals that connect us with others, and also social and structural rules that flag when we want private spaces, public spaces, ownership, inclusion, and when and how we relate socially. But how does that all change when we need more help? Today, I'm happy to introduce you to three individuals with a very unique perspective on this topic. Dr. Jane Barrett is the Secretary General of the International Federation on Aging, an international non-government organization with general consultative status with the United Nations and its agencies, including formal relations with the World Health Organization. Representing over 75 million older people through the membership of the IFA, Jane has direct responsibility for the corporation's global operational performance, quality, and strategic implementation, as well as business development. This includes leadership at the United Nations Economic and Social Council in New York, Geneva, and Vienna, and the World Health Organization. Jane is a Winston Churchill Fellow and recipient of the Queen Elizabeth II Diamond Jubilee Medal in Canada in recognition of her commitment and passion to enhance the understanding of issues relating to aging and engaging in dialogue with governments and the private sector to improve the quality of life of older people. Our second panelist, Phil Goodfellow, co-founded G Architects in 2014. He's a licensed architect with 15 years experience leading planning, design, and procurement for a variety of projects that range in construction budget from $5 to $350 million. Phil and his team have a specific focus and passion and experience in designing sensitive and inclusive buildings for seniors, including retirement homes, assisted living, memory care, long-term care homes, and residential care facilities. And in fact, when Phil spent some time as director at Infrastructure Ontario, where he was the client representative for hospital redevelopment, but he told me that he really wanted to change paths and moved into this sector because he wanted to look more closely at and work more closely with this intersection between humanity and architecture. Our third panel and the panelist and the gentleman right to my left is Simon Cheeseman, and he's worked in the fields of telemedicine and healthcare innovation for over 20 years and has helped to launch a number of large-scale technology-enabled healthcare services that pioneer new models of care. Simon is the director of Baycrest at Home, a virtual-first service for family caregivers of people with dementia. Baycrest at Home brings Baycrest's clinical expertise virtually into people's homes, addressing issues of care navigation, safety, social isolation, caregiver burnout, and access to medical advice. And prior to Baycrest at Home, Simon worked with Cabby as manager of the Innovation Office and led the Ontario Telemedicine Network's portfolio of remote patient monitoring products. So certainly 3 panelists with amazing perspectives, and I'm going to start you off into the first question. So buzzwords like age-friendly and dementia-friendly environments, common buzzwords we hear all around us. Is there a shared understanding of what these terms mean? Whose definition is influencing the design of environments and communities to address the needs of persons with dementia? In previous panels, people were asking, are we designing quote unquote villages that are ghettos? Another panelist said, are we making assumptions of need? So I'm going to start with Jane. And Jane, what are your thoughts on this?
Look, thank you very much for the opportunity for being part of this panel. It's a very important topic. You know, I think we do get stuck on definitions. You know, IFA and WHO come from the perspective that we need to create an environment that enables an older person to do what they have reason to value. And so when we're talking about age-friendly environments, you know, it does differ from place to place, but what we're wanting to do is foster health and well-being and the participation of people as they age. You know, environments are accessible, equitable, inclusive, safe, secure, and supportive. And I think we've got to look at older people through the lens of gender as well as culture, because the environment is actually going to change depending on, you know, who you are and where you're living. If I just move quickly on to, you know, this term of dementia-friendly environments, and I'll leave the word village to one side because I think that there's a real case to be discussed there. But I see dementia-friendly environments within the framework of an age-friendly environment. We strongly believe that whether the person has dementia, diabetes, heart failure, they have a level of function that we want to maintain and in some stages improve. So that's the perspective that we come from, not the label, but really how do we create this enabling environment?
Thank you, Jane. Phil, your thoughts on this?
So I think it's interesting that you brought together both the buzzwords age-friendly and dementia-friendly. First, to start with age-friendly, we're a big advocate of the work of 880 cities, which is based on the premise of the idea that if you design a space well enough, and whether it's part of the city, part of the social environment, or part of a building, it is enabling for anyone from the age of 8 through 80. So our approach to design and designing age-friendly environments begins with that lens, thinking about how would both a child, but also an older adult, navigate the community in the space. And I think that comes to the second point of the question, which is about dementia-friendly. And it's funny how we all pause and want to say village, because that's the buzzword that's been kind of ingrained in our consciousness over the past 4 years. But I think there is some concern about potentially creating dementia-friendly or dementia environments that are exclusive of the normal world. And I think that's where, when we think about age-friendly, we need to look at opportunities to bring a mix of differently aged people into a space where they can interact in an environment that it begins with normal, and then potentially looks at opportunities to restrict access to certain areas to maintain someone's safety and security. And I actually really appreciate that at the end Jane brought up culture and gender, because I believe that is kind of the next wave that we are going to have to really tackle when we think about how we build environments or space for those coming from a different culture who may not have lived their entire life in Canada, but are retiring or aging in Canada. And those gender issues are just at the cusp of social norms right now. And I don't believe that our aged space or our elder space really adequately addresses those. And I think that will be a moving target for many years.
Thank you, Phil. Simon, your thoughts on this?
Well, we've already used the phrase, the enabling quality of an environment, and we know that every environment, built or otherwise, is enabling of certain activities and capacities. And as we try to modify an environment to compensate for certain lost capacities, whether cognitive or physical or sensory, and trying to make it more age-friendly or age-appropriate, I think there's a lot of focus on the personal enablement. So how do we create more independence for that person who is going through those changes? But every environment is also relationally enabling. So every environment is meant to help me achieve whatever our most appropriate goals are for that. Here at work, I'm given an office where I can close the doors. I have a digital infrastructure that I can tap into to do my communication needs. But it's also created to foster the social relations I need to do my work as well. And that's also true for the home environment. And that's something that I think, because Bakers at Home has such a focus on caregiver support and helping caregivers who are still giving assistance to their family or friends that are living at home, I've become extra aware of the kinds of doors and windows, literal and figurative, that we build into our environment to meet those goals. And independence isn't really what we should be striving for, but kind of the relational autonomy that we all already live with, and adapting the environment to meet those shifts in the kinds of interdependence that we have as we age. We rely more on our family and friends, their needs for being in our environment or reaching into our environment change. And so there's an aspect of age friendliness that speaks to not just making the space more safe and accessible for the person, but also to allow for a kind of relational autonomy for the kinds of supports that they need coming and going from that space. And that's an area that I think doesn't get looked at very often.
Phil, take what Simon is saying and get a little more specific. What, in your experiences, when you've looked at that intersectionality between humanity and the places we create. What are some of the critical ingredients you found work well, and what doesn't work so well?
Well, I think when we're approaching designing dementia-friendly environments, I really actually recognize exactly what Simon's saying when he talks about relational autonomy, because that's the first bridge that we have to cross is having a better understanding of the resident, and the care that they require, and how they may or may not be able to access different services, areas, amenities of the space that we're designing. And in many ways, over the past number of years, there has been the severe swing towards security, safety, has really, I think, hit the end of its swing, and it's starting to come back towards recognizing the humanity of the resident, understanding the whole person, and providing them with some form of safe and controlled autonomy within the space that they live, so that they can live within a normal environment. So often there are conversations early on trying to understand where on this, I'll use the word spectrum of dementia, but how capable and able the resident may or may not be to be able to live autonomously or with a family member, because again, many times we'll have a family member who is providing support, almost masking the real need that the resident with dementia may need. So it's really about uncovering and understanding that, but also understanding not only about the resident, but also about the organization and the caregivers, and being able to understand where they're comfortable treading and where they're not comfortable treading from an approach to that level of autonomy. The other key piece is we all know that direct caregivers or caregiver support, that supply is limited today, and in the future it's going to be even more difficult to find qualified nursing staff to help support these environments. So we look closely at how staff and support givers are having to move through the space to provide services, so we can really understand how much direct contact time they have with the resident versus going to a supply cabinet or going to I'll call it a care station, but it may not be a care station, some type of office environment, and really trying to break that down to reduce the amount of foot traffic that's occurring, because all of those different pieces, all that hustle and bustle that we may see as being normal in a work environment, we have to remember this is not only a work environment, this is actually a resident's home. It's also complex care environments. We need to balance both the needs of the resident, also the needs of the staff and the operators who are running the space.
Thank you, Phil. Jane, from your vantage point, internationally, cross-culturally, you've probably seen many different types of models. And, you know, Western notions of independence and, as Simon is saying, relationality, in contrast to other non-Western notions of interdependence and interrelationality. What are some of the best practices you've seen out there?
You see, it's interesting that we use this jargon, isn't it?
Yes.
Because that jargon is not used,
Yeah.
you know, when you're sitting at home, either with dementia or with your family. And I think that we have to lift ourselves out of that and actually, you know, be in the moment of people and their families. Because some of the things that I observe is resilience, you know, resilience. How do we create an environment that encourages resilience, not only with the person with dementia, but their family? What would give them that courage to have resilience? You know, what are the fragrances that we need to have within an environment? We know that some fragrances actually create agitation. What are the colours that we need to be thinking of? You know, certainly the physical infrastructure is vitally important, but one word that's actually being used is, how do we normalise? Well, what is normal and what is not normal? Let's be honest.
Good point.
And we have some very good examples of dementia-friendly cinemas, as an example. You know, where, you know, IMAX is training all of their staff to be able to not support people with dementia, but to create the environment where families feel comfortable to be in. And so when we're talking about intersectionality and relational spaces, we actually need to actually be within how do we create an environment that actually maintains and improves the function of the person, as well as the family in which they're often living. And so those kinds of parameters are not often discussed, you know, in situ, but also in the design setting. And I think they're important to play into this conversation.
Absolutely. As an OT, I agree wholeheartedly. Okay, so panelists, 3 different best practices that you can think of and suggest to the audience today around designing environments for people with dementia and others around them. Sergeant, you want to start?
I think one thing I'd like to say is that the digital is too often grafted on like a shiny bauble on the side of an environment, when we know that the digital is both an environment itself. It's something that is a very practical place we all dwell in and will continue to as we age and get dementia. So I'm thinking of dealing with your email, going on Facebook, having a FaceTime call with your grandparents. And that affects the caregivers in a very direct way. I can't tell you the number of people I've seen a look of dread come over their faces as they start to think about the kind of tech support calls they have with their mothers and fathers over the phone. And like, that's a real problem that caregivers are dealing with today and will deal with more, as well as thinking about the digital as a kind of integrated whole of the environment, an overlay to the physical environment. And there is very simple examples of that, like the kinds of remote controls that we use to interact with our television sets, but then, you know, increasingly more normal advanced versions of that, where you can integrate technology into your home to automate certain functions in the home, the comfort, the heat, the light, as well as access to the home, automatic locks, and that kind of thing. So best practice is to, I think, to have a more inclusive notion of what the digital environment includes, and working to create technology that is embedded, normal, foolproof in that context.
Thank you, Simon. Phil?
So one of the key pieces that we always look at is really thinking about what the residents, I'll use the word home, what their living environment is like, what the space of the entirety of the building is. And we, rather than using the word home-like, we now focus on hospitality. And what we look at in design is making sure that in the early planning of the residence or the facility, we're planning both the resident spaces and amenity spaces and the service support administration spaces to be distinct from each other. Almost thinking like when you go to a great resort, you don't often encounter a waste cart or a towel cart in the corridor. It's all taken kind of back of house, behind the scenes. It's not normal for anyone's home environment where they grew up, where they live most of their life, to have like a Rubbermaid cart going down the corridor. So we look for opportunities to stream that away and out of sight. It may mean slightly additional area from a home perspective, but really, it really enhances and increases the residents' enjoyment of their home and creates more an environment that, again, sorry, Jane, I have to use the word normal because we haven't come up with a better word in an environment. What we want to make it more like is the first third of their life, let's just say.
Thank you. Jane, best practices.
Look, I've got 3. And the first one is, you know, low tech, high touch. I think we actually really forget the importance of touch and the importance of communicating in a clear, effective way, which means giving people more time and actually listening more carefully. Seems simple, but it's actually quite complicated. You know, the advantage of technology and the application of technology. So someone who tends to wander goes out of the front door and the sprinklers start. So that's an immediate barrier for them going further. But this is also about respect and dignity. So our environment needs to really respond to enhancing the dignity of that person and their family. And the third one is an increasing trend in intergenerational living. People with dementia and students and other people living together in cohabitation. So I think they're three important trends that are happening.
Absolutely. Thank you, Phil and Simon. Jane, you've talked about creating enabling environments, fostering health and well-being. We've talked a little bit about accessibility, equitability, the need to focus on culture and gender, intergenerationality. Phil, you mentioned this idea of focus on hospitality. Simon, you talked about understanding the value and the role of the digital in all that. And Jane, as you summarize in terms of, low tech, high touch, dignity, respect, and the whole, the kinds of programs that can be intergenerational, because designing for dementia, you're really enabling the community around that person as well. So one last question I have to all of you: if you were to speak to an innovator, what advice would you give them as they're developing solutions for dementia, to design an environment for dementia? One piece of advice. Simon, we'll start with you.
Sure. I mean, I think it almost goes without saying, but when we talk about senior friendly, it's another way of saying person-centric design. And that's, in some ways, old hat. There's a lot of best practices around how to engage your end user in the design of your solution. But I think dementia is still an area where it pushes us to respect that principle, because not only are we worried about the practical implications of involving people with cognitive decline in our design process, but I think even more importantly, society as a whole has a problem with dementia and identity. And very often we talk about the death of the person before they pass away. Dementia is very, and clinicians suffer from that. Family members, the people with dementia themselves, talk about the erasure of their own personhood. So it can be challenging to preserve person-centric principles in that environment, and we can't fall prey to that kind of bias. It's more important there than anywhere.
Well said, Simon. Bill.
From my perspective as someone who builds environments, I'd say plan and build for environments that are flexible, open, and can anticipate change, because change is what's going to come. It's going to be the constant over the next 50 years. Technology will be a part of it, but whenever a provider asks me, well, what kind of technology should I put in? I say, let's just put cabling in and Wi-Fi for the worst case scenario. We don't know what the endpoints are going to be, but let's plan for that flexibility. And I believe that's both in the digital infrastructure, but also in the physical infrastructure, thinking about potentially in the future, more environments where there's more of an intergenerational mix, whether it's between seniors and students in university, or other people who have housing needs, because that's a big part of the future.
Jane, advice to an innovator.
Look, at the heart of designing dementia-friendly environments are two things. We want to maintain and improve function where possible. But the most important word in this whole conversation for me is destigmatization. This is our opportunity to create environments, whether you're designing a building, whether you're actually designing, streetscapes, how can the environment really destigmatize, the functional deficits that a person may have, so that they are worthy, of being part of, and feel worthy of being part of a community. The great losses that we experience as we grow older in identity and worthiness and family and friends, how can an environment be built, around a person with dementia, so that they feel supported and contributing members of the community for as long as they're with us?
Great summary, Jane. Thank you so much to this panel for very rich insights. I guess, in terms of the, as you're going forward in terms of Baycrest at home, while we're waiting for a question, I'll ask you a question.
Oh, okay. I did have a question
Oh,
for Jane.
okay, go ahead.
I mean, so
Perfect.
Jane, you talked about low tech, high touch, and it's something that is so important not to lose as we rush forward with our innovations, bringing these digital gifts to our end users. And the thing that we struggle with as we're building a business is how can you make that affordable, or how can the literal touch be replaced with a virtual touch in a way that doesn't lose entirely the value of it. And so scalability, I guess my question is about scalability. How do we keep that rich interaction and still have a solution that's affordable to everyone?
We can have it all, Simon. I truly believe that, because what we tend to do, we've got people like you that actually develop these things, but there's a disconnect between the development and actually the user, and whether that's the family member. So they've got to buy into the application that will inevitably support them and their family member. So I think that we've got a bit of work to do, around that connection, and because there is a science in building that relationship. So I think we've got a bit of work to do around there.
Absolutely.
We do have a couple questions, comments, if I can interject. We only have about a minute left. One is actually a comment. Is it possible to move away from the term dementia friendly to dementia enabling or inclusive? What do you think of that in 30 seconds or less?
I'll just say that dementia friendly came out of age friendly. And if I had the opportunity, I would do away with it, because my concern is we're going to have diabetes friendly, MS friendly, etc. This is about creating an environment. And I think Phil, in your opening remarks, said it beautifully. This is about all ages.
Phil, do you want to add to that?
No, I agree. I think we need to be thinking about designing environments for all ages these days, not specifically one or the other. So I do have a problem with the word dementia, memory care, memory support. It's a very small section of the society, when we know it's the same way when we used to talk about autism.
Yes.
We used to call autism just autism, but now we understand it's a full spectrum of elements. And I really hope that dementia, we understand dementia in the same way in the future.
Yeah. We should talk about a cognitive spectrum in the same way that we talk about neurodiversity as sort of cogno-diversity.
Yeah. Well, so this builds, one thing I was going to add just right before when we were talking about technology and high touch, low tech, one piece I would push digital innovators to do is you don't always need to redefine or innovate the user interface. It just needs to be easy, cognitively easy and recognizable for one to use. In the same way that my kids don't understand what a physical telephone is, which is attached to the wall. In many ways, if you keep moving buttons around the screen and change the way FaceTime looks, older adults will not be able to use it.
Panel, I know we're reaching time, so I'm going to thank you again. This is a great conversation. I know in the breakout room we said we could be talking about this for hours. So thank you all. You've left us with some great thoughts to take forward and continue this dialogue.
Okay, thank you very much, Bianca.
Over to you.
Simon, Mel.
Nice to meet you.
Thanks, Bianca, Simon, Phil, Jane. That was fantastic. Appreciate it.
The Center for Aging and Brain Health Innovation is powered by Baycrest. To listen in and get involved, go to cabhi.com. The podcast technicians behind the scenes are Podtex. Share your What's Next Canada podcast ideas with us at www.podtex.com. PODTECHS. Podtex, your partners in podcasting.